So here's a demonstration on a skeletal model. And when I'm looking to locate the tailbone on a client, they will be lying on their stomach. And I just look at the pelvic area and I lay my hand on this portion, which is easy to recognize as part of the sacrum, but of course they're covered with soft tissue, right? So we don't know precisely where that coccyx is. So I just lay my hand here and then I fold my middle finger, and this skeletal model has a rather superficial coccyx, okay? So that helps me identify it. And then I come on both sides of it. So I come from the tip, and then I come on both sides of the tip, and I come upwards, okay? And that defines the sulcus that's underneath the transverse process of the first coccygeal body, okay? Now this one has rather short transverse processes. I've seen some that are longer than that. But let us imagine that this tailbone was side bent to the right. So the top, so this is sacrum here. It's the bottom of the sacrum. There's a disc in between. This is the first coccygeal segment. If it side bends to the right, it means the top goes down on the right. That means the tip goes over to the left, okay? And so what I would feel when I feel this sulcus coming up into the sulcus, the left side is going to be higher, a deeper sulcus, and that implies a right side bend. Some people call it a left because they're referencing the tip, but the correct biomechanical nomenclature would call that a right side bent tailbone, and I've been guilty of calling the other based on how I learned it long ago. All right, so there is a ligament that comes from the spinous process of the ischium here, and it goes to sacrum. It's called sacrospinous ligament, and it really fans out and is fairly horizontal and also attaches onto the coccyx. So if this person has a right side bent coccyx, the tip points over to the left, this ligament will be tighter. So what I do to palpate the ligament is I come below the person and again, orient myself to the sacrum and then come to the midline. And now I'm going to go a little bit further. So you can see that my thumbs are apart by at least an inch, inch and a quarter, or even an inch and a half. So I know that I'm on the bottom of the sacrum under what's called the inferolateral angle, this portion here. And I know that just slightly obliquely, inferiorly, is the sacrospinous ligament. So I come over here and I come out another inch. This is soft tissue land. There's no bone under me. That's all ligament. And then I spring it. Now it is hidden beneath the big fanning ligament, which is the sacrotuberous. It comes from the ischial tuberosity up to the sacrum, gives a little bit of fibers over to the coccyx. It's deep to that, but if you palpate it in the manner that I showed you, you'll find it, and then you load it and spring it, and you'll find it on the right. It's very tight, feels very tight, feels like bone. You'll find that on the left side has a little bit of elasticity, so you can load it. Only takes about 5 pounds of force. You can spring it, it bounces back. Okay, so now we move to doing a mobility evaluation. So then I come to I use my thumb and I just come over onto the right side. You can stack your thumb, number of approaches. You can also approach it from superiorly and take up the slack. And if it is side bent right, you'll find that you can actually spring it and make it side bend a little bit further, okay? However, when you come from the left side, remember the tip is pointing over to the left, okay? When you isolate it, come to the lateral portion, stack your thumbs, and you try to load it to spring it left to right, it doesn't move. So with using just about 5 pounds of force, you'll find it just does not move, and you can even thrust it with your stacked thumbs with another 5 pounds, and it just doesn't move. So that defines a left tip to the left, but a right side bent tailbone. Okay, later on we'll talk about the rotation. It's a component motion of that, an accessory motion. But that's how we would evaluate that pattern. And you might ask, well, what if it's developmentally side bent? It's just an anatomical anomaly. Well, then the ligament length would have been normal with respect to that anomaly, and so it would not have been tight when I tried to spring it here, okay? And the coccyx would not be stuck when I try to spring it left to right. So that's how you distinguish between anomalous anatomy, looking like a injured coccyx, but it's not. That's how you make the distinction. So thank you very much.